What we've got to do, because we're setting up a brand new public service in Scotland, is plan it very carefully and make sure that the 1.4 million people who rely on the benefits that we will have responsibility for continue to receive the right amount of money on the day that they expect it and to their bank account. That means that first thing we have to do in the coming year is pass the legislative framework which allows us to take that responsibility. We've then said that as soon as that is passed and the Parliament has agreed that piece of legislation, and I hope it will be by the spring of next year, spring 2018, at that point we will then begin delivering the benefits. And we'll deliver them one by one for a very deliberate reason. And that is, we're learning the lessons from what has gone before and intend to make sure that the delivery of our benefits, as well as the benefits themselves, gain from the experience of our experience panels and our other stakeholders. So we design the system to deliver the benefits, we test it, we then deliver it, we learn the lesson. The first benefit that we will deliver will be the increase in carers allowance, which we intend to deliver from the summer of 2018. All of the other benefits will come online to the Scottish Government, to our new Social Security Agency, to be completed, and we will therefore have all of them and be responsible for all of them by the spring of 2020. In terms of other changes to carers' benefits, for example, the current restrictions on the amount that can be earned in addition to the carers' allowance, or the number of hours to be worked, or even the absence of a tapering off period when the person being cared for is either dies or moves into residential accommodation, or perhaps moves on to more independent living. All of those issues are being looked at by the expert advisory group that I've put together to provide me with advice. That group is chaired by Jim McCormick from the Roundtree Foundation and has carers represented on it along with others. They will give me their views about the changes that we can make to carers allowance at the point when we begin delivering it. Some of those we might be able to make straight away. Others might take us into the next Parliament. But the most important thing that we have to do is make sure that carers receive the additional amount of money from the summer of 2018 that we've promised we will deliver, and that all of the 11 benefits we take responsibility for are delivered safely and securely. So our commitment is to increase a carers allowance to the same level as the job seekers allowance. And we will start delivering that from the summer of next year. Initially, the carers allowance as a whole will continue to be delivered by the GWP, but they will be doing that job for us. We will deliver the increase ourselves, and we'll do that in 2 payments a year. The first one, as soon as the legislation is passed, so the summer of 2018, but it will be backdated to April 2018. So 2 6-monthly payments until, by 2020, we're delivering the carers allowance in full from the Scottish Social Security Agency. It's a reasonable point to make, and we made that commitment in our manifesto. The case can be made for additional support where an individual is caring for more than one disabled person, and our expert advisory group will be looking at that for us and providing some recommendations to me about what we could do, what we might do, and how much that will cost. There's 2 parts to the answer to that question. On the second part, where we're talking about devolved benefits, then it is for us as a Scottish Government to make sure that any additional income we make sure people have through our social security system is not taken away by changes in another part of support that we offer as a government, like council tax reduction. As far as the benefits and support that people might receive that are delivered by the UK government, There is an agreement between Scottish Government and UK Government, which in essence says this, that where an individual's income increases as a result of decisions made by the Scottish Government, the UK Government will not penalise that individual. In other words, if the increase, for example, in carers allowance takes an individual over the current UK imposed benefit cap of £20,000 a year, that individual would not have the benefit cap imposed on them for that additional amount that the Scottish Government has provided. It's fairly straightforward, it's fairly clear. I understand it can at times feel a bit complicated and confusing, but the bottom line is the Scottish Government will not penalise individuals, take away with one hand what has been offered with the other. And we have an agreement with the UK Government that they should not do that either, and we will monitor that very carefully. Not immediately. Like I said, the most important priority for us is a safe and secure transfer of the benefits. And what we've got to remember is that that is not as straightforward as it sounds. We have 11 benefits out of the total number of social security benefits provided in the UK. So we have to unpick those from the UK system and design them and deliver them for Scotland, but make sure that they plug back in to the UK benefit system as well, where, as a previous question suggested, an individual might be receiving financial support they're entitled to from both the Scottish Government and the UK Government. So in the first instance, when we take that carers allowance, we won't make immediate changes in terms of residency. But again, that's an area to be looked at. Think of it like this. We are going to take those 11 benefits. We're going to make the changes we've already committed to in terms of increasing carers allowance, changing the Sure Start grant to the Best Start grant, so there's even more financial support for mothers and children, not just the firstborn, but every child, making changes in other areas too. But in the longer term, we need to look again as a country about what kind of benefit system do we want in Scotland? Is disability, is the current personal independence payment or disability living allowance the right kind of support for disabled people or disabled children in Scotland? Is attendance allowance the right kind of support for our older citizens? That is the next step once we have those 11 benefits safely transferred to us and delivered competently by our new social security agency. And getting us to that point is where our experience panels, our expert group chaired by Jim McCormick, and our stakeholder groups, all those organisations with real knowledge and experience of the individuals and the issues that we're talking about, all of their views will help to form government decisions, because the way we build this system is from the ground up. About a year ago, the First Minister, Nicola Sturgeon, said that she wanted us to look at what additional support we could offer for young carers. Carers allowance is there for young carers from the age of 16, but she wanted us to look at what more we could do. So in the past year, we've been looking with young carers themselves at additional support that could be offered, which could include a financial element, but could include other things that are important to them. And I hope that in the autumn, the First Minister will be able to announce exactly what that additional support for young carers will be. Whilst we're busy putting the legislation through the Parliament, a number of other areas of work are all going on at the same time, because our timetable is quite a tight one to make sure that we deliver benefits, starting with the carers allowance supplement next summer and completing that exercise by the spring of 2020. So that, quite rightly, that means that we are building the new Social Security Agency for Scotland as we speak. We've said that that will be an agency directly accountable to ministers, to me, so that I am held directly accountable for how it works. We've also said that there are jobs that the agency will do, like a payment system, like ensuring proper governance, like decision making and so on, that can sensibly be centralised. But in addition, that we want our agency in Scotland to have a human face. So we will have social security staff in every single local authority area across Scotland. And right at the moment, our officials inside Scottish Government are working with local authorities and health boards across the country to help me decide how many people, local staff, we should put into each area across Scotland. In addition, we intend to be able to announce where the central agency will be located again in the autumn of this year. But that central agency won't be in a big shed in an industrial unit somewhere. It will have a face towards the local community too. You will be able to go into that organisation, into that building, and get the help and support and the information that you need. I am determined that if we are going to deliver a social security system that is rights-based and uses the principles of dignity, fairness and respect, then you should be able to speak to that agency, to a human being in that agency, as well as phoning it or contacting it online. And so even our central location will have that open door for people to come and get the help and the support that they're entitled to. Yeah, it is a big issue. We reckon, just from DWP figures, that about 500,000 people in Scotland are not receiving the support that they're entitled to. It's possibly more than that, because not all the data is collected at that UK level. So we have begun, as the Scottish Government, a media and local press campaign with the support of Citizens Advice Bureau to encourage people to think about whether or not they're entitled to that additional support and how to go about claiming it and receiving it. But only last week, I held a round table with the support of Alex Rowley from the Labour Party and Councillor Parry from COSLA, the COSLA spokesperson on this issue, with local authorities and health board representatives to make sure that we have a coordinated and concerted campaign over the lifetime of this Parliament. The next step that we'll take is that we will do some more of that general awareness raising work. We will then focus on particular groups, but we will come up with a shared plan between ourselves and local authorities and health boards that mean that we, over the next 3 to 4 years, have a real push on making sure that people across Scotland pause and think for a minute that there is support that they have a right to, that they should then go about trying to claim. And we'll make sure that initially local authorities, support staff, Citizens Advice Agency staff, and then our own Social Security Agency staff are all on hand to provide the advice and the information and the support that people need to claim what is rightfully theirs. So at the moment, we are working through that stage programme that I've described about the legislation, building the agency, then beginning to deliver on the benefits. The experience panels that we have, those 2,400 volunteers, are individuals from right across Scotland who have personal experience of the benefits system at a UK level. And they're helping us to design our benefits and our delivery system, our payment system, how we communicate, the language we use, how open and accessible they are. And they're, if you like, a big counter to make sure that those principles I talked about are actually delivered on the ground. They have a job as well to tell us what we need to change about disability benefits, as well as the expert group I mentioned earlier and those stakeholder groups. But one of the things that we know for sure, that I've said for the last year, is that the evidence that needs to be gathered to support an application for a disability benefit is evidence that already exists. We start with the individual's own assessment about the disability or the health condition that they have and how that affects their ability to live as independently as they want. We then look for where there is supporting evidence to that. It may be in their health records or from healthcare workers that they are involved with. It may be from social care. And with the individual's permission, our intention is that we can access just the information we need to support what it is they're saying to us. My intention, therefore, is that we have many, many, many fewer assessments, one-to-one assessments, very different from the current UK system. And where we do have assessments, health assessments, they will not be conducted by the private sector, not in our social security system. So we already have committed to making some important changes to disability benefits in Scotland, but there is more to do. And the experience panels and the expert group will be the folks with the real experience and the expertise coming to me with recommendations about other changes that we ought to make, and we'll be looking carefully at those.